Welcome everyone to today's webinar. We'll give it just a couple more seconds and then we'll get started. Alrighty, we will get started with today's webinar. I appreciate everyone joining us today to talk about the Healthy Aging Data Profile that's being produced and some of the measures that CIVHC produced as part of this. Today's presenters will be myself. I'm Kari Degerness. I'm the Director of Healthcare Programs here at CIVHC. And we also have Erica Felder, who is at the state and helping to pull together all of these different measures and doing a lot of analytics along with that. Just a few housekeeping items. All lines are muted. We do encourage questions in the chat box, and we will have some time at the end. This webinar is being recorded, and we will share the slides along with the recording at our website under the Events Resources page on civhc.org. So to set the stage, we want to just share a little bit about what CIVHC is. Our mission is to equip partners and communities in Colorado and across the nation with resources, services, and unbiased data needed to improve health and healthcare. We are a nonprofit, nonpartisan, independent, objective party that helps to provide some of those data pieces as well as the community convening. We serve a broad range of different individuals, from hospitals to community-based organizations, researchers, and state partners. We do this in a couple different ways. We do quite a bit of public reporting through the Colorado All-Payer Claims Database data, and I'll talk a little bit more about what's included in that and how it fed into the report. We also do non-public releases of information to help support different projects. That was included in this. We released these measures to help support the broader initiative with the Healthy Aging Data Profile for the state of Colorado. And we also do a lot of programmatic work, which is what I do in the aging space, as well as advanced care planning, palliative care, and we do work with a lot of different community partners. We also have recently added research and evaluation services to help evaluate programs, their effectiveness, things like that. So what is an all-payer claims database? It's a database that is rather large that hosts a variety of claims-based information from medical, dental, pharmacy. It does allow you to capture longitudinal information on individuals. So you can track a patient from different times in their healthcare history to be able to understand things like utilization, frequent visits, different disease processes, all of that information. So we can track that along patients. We do have all insurance companies. So you can look at Anthem and Cigna and all of those different things and look at it across demographics as well. So you can look at rural, urban, things like that. There are currently about 19 states across the United States that have some form of all-payer claims database, also known as an APCD. Wanted to specifically talk a little bit more about the Colorado APCD. We have about 1 billion claims. We do cover about 70% of those covered lives that have health insurance coverage. We do have quite a few commercial payers, as I mentioned. We also have Medicaid, Medicare Advantage, and Medicare fee-for-service information, which allows us to really look at those different payer types, understanding the differences in utilization, differences in costs, things like that. There are some pieces that are not included in the APCD, including federal programs such as the VA, TRICARE, and Indian Health Services. we don't have any of those uninsured lives or individuals that are paying out of pocket for those healthcare services. So think about anything that generated a claim. We can look at that information and do some analytics and help better understand that and use this information to help improve lives across Colorado and the nation. We've touched on most of this. We do have medical claims, professional claims that you would see if you went to your physician office, any dental services, those pharmacy claims for fill rates, things like that. And then information about the eligibility file. So anyone who has insurance has an eligibility file, whether or not they use their health insurance or not. Non-claims data, some of them are included in this in terms of alternate payment models, drug rebates, things like that. So we're constantly looking for new ways to incorporate some of those new methods of payment models and things like that. We have a number of public reports, as I mentioned. They've got a wealth of information that we encourage you to look at and help to support the information and support the work that you're doing. One of the biggest pieces that is fitting into this aging data profile is the programmatic work and community engagement, which I oversee. So we really try and make really strong integrated partnerships with those community organizations on the ground doing work and helping to bring the data to help support that work. One of the big focus areas that has been in place since we started is about palliative care. And palliative care is really the supportive care services. It's an interdisciplinary approach to helping to support those that might be experiencing serious illness, such as cancer care. We did work as a collective to have a statewide definition. So that included that interdisciplinary individuals from physician, chaplain, nursing, all of that. And so there's a statewide definition for palliative care services. There's been a lot of push for education and awareness so individuals can capture this information and really utilize it at the time that they need this care. On our website, you will see that there's a map of palliative care providers to help locate those services, as well as the State of Palliative Care Report, which talks about how much utilization there is, what kind of services, what kind of patients, that kind of thing, to help inform and advance palliative care across the state. We're also engaged with the Colorado Medicaid office to see about building in a palliative care benefit within that. So these are just a couple ways that we've been helping to support palliative care across Colorado. We also do a lot with advanced care planning. And as some of you probably are aware, advanced care planning is really a set of tools and the process of really planning for care when you may need it. So CPR directives are part of that, identifying an individual that can help make those decisions for you if you should not be able to make those. And we do approach this work in a couple different ways. We do have a really strong work group that helps to develop these strategies and really advance this work. We have developed, actually we're developing today and tomorrow, recording some of these first responder trainings so that they better understand and utilize advanced care planning. And we're doing that in conjunction with South Metro Fire and Rescue. And that is from a generous donation from Tomorrow's Choices, one of our partners. We also became the Colorado Medical Order for Scope of Treatment program, the MOST program in 2018. So that's housed on our website. And we do a lot of additional training around the MOST because it is such a complex document and requires some clarification and support. And we're working with our partners at Telegen to really build that along with CIVHC and Leading Age. And getting to one of the big pieces and my passion, which is around supporting older adults and aging in the state. There are a lot of different pieces of work that are happening across Colorado and have been for many years, and wanted to sort of set the stage with all of the data that Civic has, all of this programmatic work, and really feeding into the work that brought about this healthy aging data profile to help support these different initiatives using that data. So Civic does engage with a lot of these different pieces. The Colorado Commission on Aging is a new commission that exists and is started just in 2022 through House Bill 2022 1035. It's an amazing, different, dynamic organization and is really using the data profile to help advance the work that they're doing, help set some of those priorities. And so we want to keep engaged in this, and we're really happy that we were able to support through this data. There's a lot of work around Alzheimer's disease and helping to improve age-friendly services, not just for those with Alzheimer's and other dementias, but across the systems, really making sure that we have those person-centered services. And again, this data is helping to support where are those services being provided, what does that look like, how many different diagnoses of dementia and Alzheimer's and things like that. And Erica will go through a little bit more about that information here shortly. There's also the Colorado Center for Aging that does advocacy work on behalf of older adults. And then one of the big pieces that just sunset, which led into the Colorado Commission on Aging, is SAPGA, the Strategic Action Planning Group on Aging. And one of the different recommendations through that work was to create these data profiles to help support that work. So I wanted to talk about all those pieces because it leads into why Civic is involved in this project and how that project is going to help support a lot of these initiatives that I just touched on. So now I'm going to turn it over to Erica.
Thanks, Kari, and hi, everyone. As Kari mentioned, I'm Dr. Erica Felder, and I work with the Department of Human Services for Colorado. So the precipice of this work has turned into the Lifelong Colorado Data Dashboard. Lifelong Colorado is an initiative founded in the governor's office. So on September 18th, 2018, Colorado Governor John Hickenlooper declared Colorado as the third state to join the AARP network of age-friendly states and communities. There were 8 member organizations and 17 interested community partners to support this age-friendly work. We had insights from different organizations such as AARP, Dr. Cog, SAPGA, state departments like DOLA, HCPUF, CML, CCI, and there was foundation for support from Next 50 and Rose Community Foundation. And so where this work with Civic comes in is that there was a recommendation to create a data dashboard to inform the work. Go to the next slide. So we have a lot of examples from other states where they've brought together different data sources on aging into one place that really informs a lot of the work on aging going on in the state. And that's what we hope to replicate here in Colorado. So some examples include California's Master Plan on Aging dashboard. There's northeastern states that did healthy aging data reports. Minnesota has aging data profiles. New York City has an interactive map of aging. Florida has elder needs index maps. And then there's America's Health Ranking Seniors Report that does state level profiles of different states. And again, all of these sources are bringing in data from a variety of places. Go to the next slide. So the goal of our Colorado aging data profiles, or what we're now calling the Lifelong Colorado Data Dashboard, is that we wanted to have a place where we brought together all of this data on older adults and aging in Colorado. So we could have sort of a central repository that would be able to inform work on aging in Colorado. For our indicators that we were looking for, we wanted measures that we could track over time. We can really look at progress over time and whether different initiatives make a difference for our aging population. We wanted aggregated data or data that can be or already is shared publicly. We really wanted this dashboard to be publicly available and accessible and used by everybody who has any interest in aging data. And then our goal was we really wanted a statewide and local level set of data. So we're breaking out our data dashboard by counties. We're looking at different age ranges because we know the aging population 60 and over is not a monolith, and we need to look at measures within different age groups to also look for trends, and then different demographic characteristics such as rural and urban, race and ethnicity, and other different demographic breakdowns to really have an informed look at the aging population. And then again, this work is hopefully going to help all of this great work that is happening across the state in aging. And we have been working on this data dashboard, myself and Jarrett Hughes from the governor's office, for 2 years now, or over 2 years. So we've collected a lot of feedback from stakeholders and partners on what would be really helpful to see in a data dashboard. So we wanted all of our data that goes into the dashboard to really be informed by the needs for data in the state. And go to the next slide. So in addition to the data from the All Payers Claims database that I'll talk about in a moment, we have some other data sources that we've included. So we have data from the American Community Survey, the Behavioral Risk Factor Surveillance System, the Elder Index, National Housing Preservation Database, Health Resources and Services Administration, U.S. Bureau of Labor Statistics, and then basically all of the state departments that have data relevant on aging or the older adult population. The next slide. So we started this really exciting project with Civic, it feels like a long time ago, to get measures from the All Payers Claims database. We based these 15 measures on work that had been done in those northeastern states, so Connecticut and Massachusetts specifically, for their healthy aging data profiles. What's really unique about what we got to do in this project is that, as Kari mentioned, the All Payers Claims database has data from Medicare, fee-for-service, Medicare Advantage, Medicaid, and private payers. In Massachusetts and Connecticut and some other states that have aging profiles, they've just used Medicare fee-for-service data. We had a really unique opportunity here in Colorado to really expand what we were looking at for the insurance payers and really try and cover more of our aging adult population. So the 15 measures that Civic developed for our profiles were the diagnosis of Alzheimer's disease or related dementia, the percentage in the older adult population, the percentage of older Coloradans with traumatic brain injury, percentage of Coloradans duly eligible for Medicaid and Medicare, percentage of eligible Coloradans with each insurance type, so Medicare, Medicaid, and commercial. And then we looked at healthcare utilization measures, such as number of physician visits within a year, number of emergency room visits per 1,000 persons in a year, number of Medicare Part D monthly prescription fills per person per year, number of home health visits per year, number of inpatient hospitalization stays per 1,000 persons, number of inpatient hospital discharges with 30-day readmission, and percent receiving Medicaid long-term services and supports, number of people receiving hospice services, number of dialysis treatments, and percentage with an average of 3 or more medications, and then percentage of the population with 4 or more out of 15 common chronic conditions. So together, we have this data from Civic broken down by age, gender, and county. Go to the next slide. So we're just going to go over a couple of examples of the measures that we received from Civic. So the first one, Alzheimer's disease or related dementia. So it was the percentage of Colorado All Payers Claims database members aged 60 and over who had Alzheimer's disease or related dementia in 2021. So a use case for this measure is that we're looking to planning for services and care needed to support those with Alzheimer's disease and related dementias. And we actually don't have great data out there until we got this measure on Alzheimer's disease and related dementias among the older adults in Colorado. So it was a really unique opportunity to get this from claims data. So we have the data table here, but if we just look at sort of at statewide at the bottom, there was 28,100 eligible members with Alzheimer's disease or related dementia 2021. And that was out of a total of over 1 million distinct eligible members, 16 over. So it looked 2.55% of the eligible population had Alzheimer's disease or related dementia in 2021. We can go to the next slide. So another measure that we had was the number of emergency room visits in 2021. So the rate of distinct emergency room visits, inpatient or outpatient, per 1,000 Colorado All Payers Claims Database members aged 60 and older in 2021. So an example use case for this type of data is that it can be used over time to demonstrate whether efforts to reduce unnecessary emergency department visits are successful. So again, here is a breakout of the data. We had member age groups, and if we look statewide, there was a rate of 4,916 emergency room visits per 1,000 covered lives in 2021. And again, in our profiles, we have this broken out by county and gender as well. We can look at the next slide. So the third measure, example measure, is 4 or more chronic conditions in 2021. So the rate of distinct emergency, this is actually the rate of the number of older Coloradans, I believe, was 4 or more out of 15 common chronic conditions for 60 and older in 2021. So actually that first, the first part of that is inaccurate. But a use case for this is that we're looking at understanding the disease burden across the state to help to target efforts and better manage chronic diseases in areas of high occurrences with individuals with multiple chronic conditions. We also know that people with multiple chronic conditions are at risk for many other factors such as nursing home utilization and other issues that we want to address for our aging population. So statewide, 34% of distinct eligible members 60 and over in 2021 had 4 or more chronic conditions. We can go to the next slide. So what's next for the Colorado, Lifelong Colorado Data Dashboard? So in addition to the data that we've gotten from the All Payers Claims Database, I've compiled additional data related to housing, demographics of the older adult population, economic security, healthcare staffing levels, overall well-being, and many other areas that will be published in an online dashboard, timeline still to be determined, and we'll be looking to highlight key insights from this initial draft set of indicators. So our goal is that we would start with a robust set of indicators across different domains that we're interested in looking at for aging. And then over time, we'll be able to add more measures, but also add the same measures over time so we can get a longitudinal look for aging in Colorado. And I believe if you are interested in looking at all of the other indicators we have, that's going to be posted in the chat. Thanks, Stephanie. And I think that's it for me. Thank you.
So we just wanted to kind of provide a couple of those pieces and apologize for the error on that last slide. That was on me. But we really wanted to kind of highlight how these different measures are not just data that's going to be on a shelf paper. We're really making sure that these are measures that are actionable and really supporting the work that's happening right now. We know that there's a large proportion of the population that's aging, and there's a lot of different factors that play into that. And the healthcare system, specifically with some of these healthcare related measures, is going to become more strained as we have a larger older adult population. And so it's exciting to finally have some really good concrete information. And especially, as Erica mentioned, there's data out there, but it's not necessarily broken out into the details, and it's not necessarily the measures that we really want to focus on. And so this dashboard provided an opportunity to really hone in on those. And then also with those aging brackets, super important to understand that those aging brackets are very different. There's different pieces, and what happens within those aging brackets is very, it changes. Our needs change over that time. And a lot of data that's available for older adults is just 60 plus or 65 plus. And that's a big bucket and a lot of variation. So it's exciting to see that we've got some of these different measures that are coming out, and then supplementing a lot of those that are looking at the social determinants of health, looking at those housing measures. What does that look like for affordable housing? What does it look like for individuals across the state? Those with different levels of education, things like that. And so you can see all of those really thoughtful choices in those different measures in the spreadsheet that Erica talked about and developed. And hopefully we'll be able to get that launched as soon as she's finished with a very big job to compile all this information. So we will go to some of the questions in the chat. Oh, Karen, good question. Looking at the death rates per 5-year increments as well. So thank you. That's a really good piece of information. And also the question from Karen about areas like economic security and housing and things like that, that's absolutely within there. And we can pull up some of those dashboards and kind of demonstrate that as well. Let's see. A member is a unique person that is within the claims database. And so one person is a member. So person and member can be somewhat interchanged. Erica, would you mind answering is there a similar chart showing ER visits for every 5 or 10-year increments? I don't know if we have that.
Yeah, we don't. Well, so we don't have that in this dashboard for birth. We just focused on the 60 and over population. That might be something that CDPHE has available. They have sort of an emergency room visit dashboard, or something that Civic potentially produces as well. But we don't have that in this dashboard. And then I can take the next question too. Betsy asked, did you look at mild cognitive impairment? And we do have measures from the behavioral risk factor surveillance system that capture more of that mild cognitive impairment. And it's a really great opportunity to put that together with the claims data on Alzheimer's disease and dementia, because yes, as you mentioned, dementia is often underdiagnosed. So those measures on cognitive impairment are listed in the spreadsheet. And then Deborah asked, do you have a list of the chronic conditions used for the data? And yes, we do. I can list them out right now, and they're also listed on row 46 of the spreadsheet that was posted. But it's the percent of covered Coloradans 60 and over that were diagnosed or treated with 4 or more specific chronic conditions in 2021. So those conditions are Alzheimer's disease or related dementia, asthma, atrial fibrillation, cancer, including breast, colorectal, lung, and prostate cancer, chronic kidney disease, chronic obstructive pulmonary disease, depression, diabetes, congestive heart failure, hypertension, hyperlipidemia, ischemic heart disease, osteoporosis, osteoarthritis or rheumatoid arthritis, and stroke.
And just wanted
Jane asked, oh yeah, sorry, go ahead.
I just wanted to add one more piece. The chronic conditions, we based on the Centers for Medicare and Medicaid list of the 16 top chronic conditions. So we did try and have some of those benchmarking pieces to make sure that we were consistent and could be potentially compared to those other states' dashboards. So.
And then Jane asked, are the aging population dashboards published on the Civic website or the Governor's Lifelong Colorado? So they are not published yet. They will be probably available on the Lifelong Colorado website, but certainly when they do get published, we'll be advertising it far and wide. But they're still in the works right now. And then Karen asked maybe on the CCOA website or at least a link, and absolutely, since this work is so closely tied to the work that CCOA is doing, the dashboard will be shared with CCOA, and I'm sure we can work on getting a link to it on there. For those who are interested, the dashboard will be published in Tableau. So that means we can embed it in a lot of different web pages, hopefully.
And just to get a little sense of what Massachusetts did and sort of what we've based it on, just wanted to share that website. You can, depending on how fancy that Tableau dashboards can be very, very complex and be able to have some of those features of Zoom and things like that. So hopefully we'll have some of these, but there are some really great tools that we're basing that on, and hopefully being able to compare and bring in some of those components. But the Massachusetts one allows you to look at those disease, look at those counties, hover over, click on them, and things like that. And so hopefully we'll be able to have some similar features. I don't want to put too many weights on Erica's shoulders, but hopefully we'll be able to do something like this. But these dashboards are really being able to help support those initiatives, and it's really fun to see multiple states coming across, and that Colorado is coming up behind everyone else and being able to do something similar. So I did want to demonstrate that as a maybe sneak peek of what might come for Colorado.
Kari, I'm going to jump in. I know it's a little unorthodox. This is Steph with Civic. I'm usually just behind the scenes. But I was checking in on the ED measures breakout by from birth. Civic has the community dashboard that we just recently released. And while on the dashboard itself, the measures are not broken out by demographics, if you request a downloadable data set, they do have age brackets in that data set for ED measures. I'm not sure that they are quite as granular as everybody hopes. I'm pretty sure that they're just the standard age brackets, but it is better than nothing. I put the link to the dashboard in the chat.
Oh, thank you, Stephanie. Appreciate you jumping in. Are there any other questions from the audience? I know we kind of went through things pretty quickly, but wanted to give you guys a little taste of what's happening. And I love the suggestions. So thank you so much for those thoughts on the additional measures, because we, again, do want to make sure that this is meaningful and applicable and helping to support the work that's actually happening. So appreciate all that. So we'll wait just a few more minutes if there's any questions. One item to note about, I think Karen, you mentioned around death records and some of that information. If you guys would like to learn more about, we have another study that has been completed, and we're going to be publishing some pieces of that analysis soon, is our cost of care at end of life study. And those are looking at decedents over 4 years, and then looking back and looking at those different interactions with the healthcare system along those 4 years right before the date of death, and trying to track some of that information. So we can share more about that report. And as soon as that publication is available, it should be early next year. You can certainly look at that, but we're also always open to chatting with folks and listening to what your needs are and seeing whether or not we can collaborate and maybe use some data to help answer some of those questions as well. So. Wonderful. Well, we appreciate everyone for joining us today. As Stephanie has been so gracious to put a bunch of different resources in the chat, this recording as well as the slides will be posted on the webinar at civic.org. And go to civic.org and then the events resources page, and all of that information will be there. We appreciate everyone for attending, and I hope you guys have a wonderful rest of your week.